to the body of the vertebra, this part of the bone that attached immediately to the vertebra, we call it the pedicle. The pedicle. This pedicle, and continuation of the pedicle, there is the laminae. This is the laminae. The laminae is somewhat thinner bone than the pedicle. So the body and the vertebral arch, two parts, pedicle and the lamina. This hole formed by the body and the vertebral arch, we call it the vertebral foramen. The vertebral foramen. The collection of the vertebral foramen, one above the other, will form a tube-like structure where the spinal cord and the meninges pass through. There are seven processes attached to the vertebral arch. At the site of attachment of the pedicle here, this is the pedicle, to the lamina here, there are two transverse processes. This one labeled with red color. These are two transverse processes at the site of attachment between the pedicle and the lamina. And where the two lamina fuse together, there is this projection. This one, we call it the spinous process, or the spine of the vertebra. At the site of attachment of the pedicle to the lamina, there are two facets superiorly and two facets here inferiorly. These attached here. I grasp them with my fingers and index fingers. Here are the inferior facets, and here are the superior facets. The facets here covered with hyaline cartilage to form the facetal joint. When you see here, this is the facetal joint. You can see the facets of the inferior facets of the above vertebra articulate with the superior facets here, the superior facets of the lower vertebra to form this joint. We call it the facetal joint. The site of attachment of the pedicle to the lamina, we call it the pars interarticularis. Here there is a notch superiorly in the pedicle. This is the pedicle, and here superiorly there is a notch. We call it superior vertebral notch, and inferiorly also there is another notch here. We call it inferior vertebral notch. In the pedicle. This is the pedicle, and this is the superior vertebral, and this is the inferior vertebral notch. When you collect these notches together, as you can see here, the notch the assembly of the inferior vertebral notch of the above vertebra with the superior vertebral notch of the lower vertebra will form a foramen. We call it intervertebral foramen. Here where the pin go through, intervertebral foramen, where the spinal nerve pass through. Each side of the vertebrae, there is some characteristic criteria for those vertebrae. In the cervical spine, we can see that the body is flat. The body is flat, and the vertebral foramen is big and triangle in shape. This is triangle in shape. The transverse process had an opening. This is the foramen here, this one, where the pin passed through, and this one here. We call it foramen transversarum. Foramen transversarum, in the transverse process, where the vertebral artery and vein pass through. Posteriorly here, the spine is bifid. The spine is bifid, and the lamina is very thin. Here is the C7. C7 has some criteria of the cervical vertebrae and some criteria of the thoracic vertebrae. The most important thing is that the spine of the C7 is very long. We call it vertebra prominence. This is very long spine, and this is the typical C7. This is the foramen transversarum, and this is the intervertebral foramen, triangle in shape, and this is the body. The lumbar vertebra, usually the body is very thick and strong. The laminae are thick, and the pedicles also very strong, and the transverse process are cylinder in shape, and the spinous process is somewhat rectangular. Superior facets, and this is the inferior facets